In this tutorial, I'd like to talk about the pectoral girdle and upper limb. So we will cover the pectoral girdle bones and their landmarks, and the upper limb bones and their bony landmarks as well. So if you look at this diagram right here, we're going to cover the clavicle, scapula. This is considered to be the pectoral girdle, and this particular structure anchors the arm to the upper body. We're also going to talk about the humerus. We'll talk about the ulna and the radius, the carpals, the metacarpals, and the phalanges. So in this diagram, you can see the clavicle. The clavicle has no bony landmarks that we have to learn for this particular course. So we will just call this the clavicle. This will be the last time you'll see it in this tutorial. The scapula has many bony landmarks, so we'll cover that in the next slide. So here's the scapula, and what I've done is I've included an anterior view, a lateral view, and a posterior view so we can see some of these bony landmarks a little bit more easily. So our first bony landmark is called the acromion. The acromion is kind of the point of your shoulder. It's the attachment point that it has with the clavicle. So you can see it in three different orientations here, and it's called the acromion. The next bony landmark is called the coracoid process. Corac means a bird's beak, and if you look at it in a certain dimension, it kind of does look like a bird's beak, and it serves as an attachment point for muscles of the upper limb. The next bony landmark is the spine. It's going to be found in the posterior view, and it's going to serve as an attachment point for many muscles that attach. So we have lots of different muscles right here, the infraspinatus, and we have the supraspinatus muscles that both go into and attach to the humerus. But these are going to be where they're found, and they will anchor themselves to the spine. Our next bony landmark on the scapula is called the glenoid cavity. In this particular diagram, we can see it in the anterior view and the lateral view, and they have a little pad of cartilage here, articular cartilage, this white structure here. So underneath of that would be on the bone, and this would be the glenoid cavity. This serves as the attachment point for the humerus. Alright, so let's move on to the humerus. The humerus is an upper arm bone, and it has many different surface landmarks. The most obvious surface landmark is probably the head. It looks like a head. It's rounded. It's a rounded surface for articulating with the glenoid cavity. Moving down from the head, we have the anatomical neck. The anatomical neck is this particular structure here that's attached to the head. So this is called the anatomical neck, and it extends over here as well in this anterior view. Our next bony landmark is the surgical neck. This is called the surgical neck because many people break at this particular junction of the bone. And I've shown over here an x-ray showing you a bone break right there at the surgical neck. Our next bony landmark is the greater tubercle. When you see the word tubercle, it means like a large bump or process coming off a bone. So this is the greater tubercle because it's the bigger of the two processes that come off this bone. The lesser tubercle is on the other side, and in the anterior view is the only view you can see this in. You can't see it in the posterior view. So just to review back, greater tubercle is the larger process coming off. The lesser tubercle is the smaller process coming off. Now in between the greater and lesser tubercles is this structure called the intertubercular groove or intertubercular sulcus. And in this picture right here, in this next picture right here, if I can get that to come up, we have the biceps brachii is a muscle that allows us to move our lower arm towards the upper arm. And there is a tendon that goes through the intertubercular groove. So this is a tendon of the biceps brachii, and it comes over and then attaches into the scapula. So that's kind of the job of the intertubercular groove. Next, we have the deltoid tuberosity. It's only obvious in the anterior section, and it's going to be found laterally. So laterally means to the side of the body. So it's this little kind of rough area, almost like a little bump that comes out, but it's a roughened area, and it's called the tuberosity. The job of the tuberosity is to serve as an attachment point for the deltoid muscles so that we can take and we can move our arm outwards or laterally. Next, we have the coronoid fossa. This is a depression that will articulate with the coronoid process of the ulna. On the back surface, the posterior surface, we have the olecranon fossa, and this will articulate with a part of the ulna called the olecranon process. On the anterior side and the posterior side, you can see an articulation point that will serve as an articulation of the ulna and the humerus, and this is called the trochlea. So you can see it. What I did is I put in a line there so you can see that the trochlea extends from this point to this point. It's this whole smooth surface. So on the back or posterior surface, it's this whole smooth surface there. It's smooth to basically serve as a nice articulation point that provides no friction, no little bony fragments or friction between the two articulating bones. Next, we have the capitulum. So cap kind of means head, and it looks like a little round head. It is going to be found on the lateral side. So if you remember, the lateral means away from the midline of the body. So it's going to be found over here on the lateral side. This is going to be medial over here on this side of the bone. So the capitulum looks like a head. And what do you do to a cap? So a cap goes on a head. So this is basically the capitulum. Okay, so it's different than the trochlea in that it looks round and it looks like a head. You also can see that it's opposite of the medial epicondyle, so it's lateral. Next, we have the lateral epicondyle. The lateral epicondyle is above the capitulum, and it's, of course, on the lateral side of the body. So you can see it here. It's a little bit better view from the posterior surface. So that's called the lateral epicondyle. The medial epicondyle is going to be found on the medial surface. So we have, or the medial side of the humerus. So here's the medial side. It's a large process that comes off, and you can see it on the posterior over here. Now, the medial epicondyle is kind of an important feature to know because this is a place where a lot of people have problems, especially people that do things like golf and tennis. So you can see in the medial epicondyle, there's many tendons. Tendons connect muscle to bone. There are many tendons of your forearm muscles that come in and connect into the medial epicondyle. So if you overwork these muscles, then you can sometimes get tendinitis there, and that's a big problem for some people that do some sports. Our next bone is the radius, so we're moving down into the lower arm bones. And on the radius, we have the radial tuberosity. It's a big bump, kind of rounded bump that comes off of the radius, and it serves as an attachment point for the biceps brachii. So here we have the biceps brachii coming down, and it attaches here at the radial tuberosity. So we can grab a hold of the radius and pull the arm towards, the lower arm towards the upper arm. We then have the styloid process, which is a little bony feature that sticks off of the radius. You can oftentimes palpate that is, feel it in your wrist area of your arm. And the radius also has the head. The head is circular, and it's towards the proximal part of the bone. Next, we have the ulna, which is beside the radius. The ulna is going to be in line with the pinky, and so up here we have the elbow, and down here would be where the wrist is. Okay, so this is going to be the bone again that's in line with the thumb in anatomical position when your arms are in anatomical position. So the ulna has many different parts. The olecranon process is going to make you up your elbow, so it literally is your elbow. And I put the arrows in the anterior view picture toward your right, and then on the left-hand side I put in a picture from the side view so you can see that it literally makes up your elbow, and that's called the olecranon process. Of course, that articulates with the olecranon fossa of the humerus. The next part would be the styloid process. It's a little part that you can feel or palpate if you feel your wrist toward the pinky side of your wrist. We also have the head, which is going to be down toward the wrist as well. Up at the more proximal region of the bone, we have this notch called the trochlear notch. The trochlear notch is responsible for joining or connecting or articulating with the trochlea of the humerus. It is a very smooth notch, so you have a nice smooth frictionless articulation with the humerus. I put in a line there so you can see that it's that whole width within that area. Next, we have a process that is a bony extension sticking off towards you, and that's called the coronoid process. And this is going to articulate with the coronoid fossa of the humerus. Over to the side is the radial notch. It's going to articulate with the head of the radius. So let me grab my laser pointer. So here you can see the head of the radius is going to articulate with that notch. That notch is smooth and the head of the radius is smooth, so you get a nice articulation there that's frictionless. Here I put in a side view so you can, with the radius removed, so you can see that it literally is a smooth notch right here on the ulna. Alright, next we'll move down to the bones of the hand and wrist. So we do have 8 carpal bones. The carpal bones are down here in purple, and there's 8 of them. 1, 2, 3, 4, 5, 6, 7, 8. They each have their own name: trapezium, trapezoid, capitate, hamate, scaphoid, lunate, triquetrum, and pisiform. So we'll learn those particular bones in just a couple of minutes. So 8 carpal bones. So I like to use the mnemonic time to come home, so leave there pronto. And if you look over here, this particular hand is going to be the right hand in anatomical position. So there's the thumb, there's the pinky. So from thumb to pinky, time to come home. From thumb to pinky, so leave there pronto. So literally you have 2 rows of bones. This row of bones is distal, this row of bones is proximal. So from the distal, time to come home, so leave there pronto. So that's a little mnemonic. Now, what does the mnemonic tell you? It tells you the first letter of each of the different carpals. So time, trapezium, to, trapezoid, come, capitate, home, hamate, so, scaphoid, L, lunate, or leave, lunate, there, triquetrum, and P, or pronto, is pisiform. Now you have to be careful because you want to make sure that you understand that the left hand would have the mnemonic going in an opposite direction. So here we have it going from thumb to pinky, distal row, time to come home, thumb to pinky, proximal row, so leave there pronto. Trapezium, trapezoid, capitate, hamate, scaphoid, lunate, triquetrum, and then pisiform. So now I'm just going to show you each of the bones in isolation. So there's the trapezium, trapezoid, capitate, and hamate. Then we have scaphoid, lunate, triquetrum, and pisiform. Moving up from the carpals, we have the 5 separate bones called the metacarpals. These metacarpals are numbered from the thumb side to the pinky side, 1, 2, 3, 4, 5. So we have 5 metacarpals making up the palm bones. Moving up, we have 14 separate bones that are the phalanges. So each of your digits has 3 phalanges, except for the thumb, which only has 2 phalanges. Okay, so you can see 3 phalanges for each of the fingers, except for the thumb, which only has 2 phalanges. And so the phalanges are going to be labeled, and this is incorrectly labeled, my apologies for that. But this right up here, these green bones are representing the proximal phalanges. And unfortunately, this is labeled incorrectly as well. The blue bones are representing the distal phalanges. Excuse me, the middle phalanges. And then next we have the most distal of the phalanges, and those are called the distal phalanges. So I apologize about my mistake there, but we have distal phalanges. The blue bones represent middle phalanges, and then the green bones represent the proximal phalanges. Of course, these bones right here are the metacarpals, and then these are the carpals.